A consequential city council vote looms Tuesday with millions in possible cuts to proposed healthcare spending. Here to talk about it, we're joined by Jennifer Ryan, CEO of Volunteers in Medicine. Good morning, Jennifer.
Good morning.
Mia Jones, CEO of AGAPE Family Health. Good morning, Mia.
Good morning.
Angela Strain, CEO of We Care Jax. Good morning.
Good morning.
So I'm going to start with you if I can, Angela. The council initially cut from the mayor's proposed budget $3.77 million on healthcare spending. Some of that has been restored. Catch us up a little bit on where we are in terms of restoring funding, what's happening on that front, and what is going to be happening Tuesday night.
Thank you so much for having us this morning. One of the biggest cuts, of course, is to our collaborative of free and charitable safety net primary care clinics. Under the Curry administration, under President Freeman's mantle, they added our safety net collaborative to the strategic plan of the City Council because it is working for the community. Previously, they were funded at $166,000 a year. They were reduced to zero, but fortunately, we were able to see $45,000 of that restored, but that is still a significant cut. That's huge.
These are six providers, and we have representatives from two of those six here today. We'll be talking about the work that they do, but basically the funding for each of those six providers was initially cut to zero.
That's correct.
And basically a quarter of that has been restored.
Correct.
And that's just one part of this overall budget, picture when it comes to healthcare. Talk a little bit about the work that We Care Jax and the Jax Care Connect specifically does. Jax Care Connect is sort of I think you described it as a front door that sort of brings people in, helps them access healthcare, but also, get over some of the hurdles that might prevent them from accessing healthcare.
Absolutely. So this Duval Safety Net Collaborative is six of our safety net clinics in We Care Jax. For more than 30 years, We Care has been the advanced diagnostic and specialty care network for our safety net. We are able to provide support for patients with no cost to the patient or their family when they need an MRI or they need to see a cardiologist or a pulmonologist. Our primary care clinics, they are the captain. We make sure that every patient is having a wellness visit a minimum of once a year. When they come to us, that is one of the requirements. Our safety net clinics have been incredible. One of the things we found in years of study together is that with 900 square miles of a county to cover, many times our uninsured neighbors, of whom there are over 100,000, they often didn't know how to connect to our primary care clinics. They didn't know geographically what was the right one. They didn't know, based on their income, which was the right one, or the complexity of their need. And that meant they found themselves often in an emergency room for a condition that really should have been covered in primary care. Jax Care Connect was the result of that study. And as a collaborative, we launched a pilot for 3 years. At the end of that pilot, with our Jax Care Connect patient health advocates, we saw that 60% of patients did not return to the emergency room for a full year. And moving forward, we're now in an operating program with Jax Care Connect, and that percentage has actually gone up to 76%. So it is a working solution for our community, and it is the front door to the safety net primary care world.
You talk about, the issue of bounce back patients. There was a recent meeting where a number of people from the medical community and the advocacy community spoke to the city council asking to restore some of those funds. And one of the people that spoke was Dr. Mario Paludo, who's the chief medical officer of Ascension St. Vincent's. Let's take a listen to what he had to say.
The benefit of their survival and long-term benefit is not measured in the interventions performed exclusively in the hospital. The larger benefit comes when you start to have medication compliance as it relates to your diabetes care, as it relates to your post-heart attack care, and we have the medication compliance to support your stent not clotting off some days later. These are real cases and real examples that we see, and unfortunately we see the returns to the acute environment in the ERs and in the hospitals when these patients come back without access to care.
And so the clinics can help people, access the care that they need. This issue, though, of preventing additional healthcare complications because somebody's discharged from the hospital and perhaps not getting the follow-up care that they need can really undo whatever services that they've received already. Mia Jones, is that something that Agape Health sees, works with patients on?
We do. Patients can come to us whether they're insured or uninsured. Oftentimes, when they do come to us, they are at in a place where they are far more progressed in whatever their illness is. They're not just coming for an annual visit most of the time.
Mm.
They're coming because something is wrong and they need help. And so, what we find is we get referrals from the hospital for those who don't have primary care, and we will work with them, especially those chronic disease patients, to make sure that they stay out of the hospital, but to get that care and that education to understand what it is that they're living with and how they should best live with it.
There can be, people have complicated lives and health can really complicate someone's life, but often that comes on top of other challenges people might have in terms of accessing medical care just via transportation or having the right food to eat to make sure that they're living, having a diet, for instance, if somebody has a diagnosis of diabetes, so that they're able to eat appropriately. How do you find those additional hurdles impact people that you're caring for?
They are very difficult for the patients to overcome. And with the cuts that we're finding across the board, it's going to be even harder. So we partner with Feeding Northeast Florida, and we have pantries at our various clinics where our patients can get a prescription for for food, recognizing that food is a part of that medication. And when Feeding Northeast Florida gets cut, the amount of food that we have is reduced, and then our patients don't have that access to those fresh fruits and vegetables because most of them live in food deserts. And because you're living in a food desert, what you're going to find in your neighborhood is the fast foods, the processed foods, and those things that are going to be within their budget are going to be those things that are not healthy for them. And so all of those pieces become hurdles that they have to cross, and then it creates for them just more issues that they have to deal with. And so we work collaboratively within the clinics. We work across the nonprofit sectors in order to try to create an environment for our patients that when we know that transportation is an issue, then we work with them to get them where they need to be. We know if we can get them to the right place the first time, we're saving money for the entire community. And so whether that's the right clinic, whether that's the right nonprofit organization, we know that when we listen to the constituents, we're recognizing that, okay, there are things that they need. We don't need to give them what we think they need. We need to give them what they actually need so that we can save ourselves money.
Jennifer, I want to ask you about volunteers in medicine. That's one group that is one of these 6 safety net providers. Funding is being cut from what was proposed in the mayor's budget. We said a quarter of what she's proposed is basically is what's on offer. I wonder if you could talk about the need, because some, health proposals that the mayor has remained flat in terms of their funding, as others have seen cuts. What are you seeing, though, in terms of the need? I know that you have talked about, for instance, some new state laws that have impacted patient load, and a new requirement that basically, hospitals have to provide an outpatient discharge plan that involves aftercare, which is a great thing, right? But it does change the landscape for providers.
And there's a lot going on to impact the increase in patients we're going to see. And that is one of the major ones. And we're very proud to be one of those places that our hospitals see that they trust to take care of their patients after they leave the emergency room. So there was a bill passed that went live this past March. So we've been seeing an increase. So these city funds would really, really help us. In addition to that, we're seeing changes in who qualifies for Medicaid. We're going to see changes in the subsidies to the Affordable Care Act. There's a lot of people that are going to be in need of health care. And so we're also a part of Jack's Care Connect, where we're being referred patients through that. That's also a direct conduit from HealthLink Jax, which is a city health initiative to increase access to health care. So we're all seeing these increases from all different angles. So the funds really would help us tremendously. But I will say a lot of us, we're nimble and we will do what we can because we are relevant to our community. So one of the things we do at Volunteers in Medicine is we have volunteers and they are committed. We have 300 a month. And so if we don't get this funding, I'm going to rely more on volunteers. And they're actually willing to step up and help more because they truly believe in what we're doing to keep people working, to keep them healthy, and to keep them out of emergency rooms.
If you're just joining us, we're talking to 3 local healthcare CEOs about the impact of proposed budget cuts. You can join the conversation by calling 904-549-2937. You can also email First Coast Connect at wjct.org, or you can reach out on social media. Angela, I want to ask you about what Jennifer mentioned, which is, the federal landscape and how that's changing. We know that the proposed cuts that have been part of the big, beautiful bill that was approved is there are already a number of uninsured people in Duval County, but there are about more than 200,000 people who are on Medicaid and 164,000 people who receive their insurance through the Affordable Care Act. All of those people expected to be greatly impacted by major cuts to these federal programs.
That's right. The Centers for Medicaid and Medicare tell us that Florida is going to be losing roughly 4 million across the state. The Affordable Care Act, there are some projections that premiums are going to go up about 75%. We know of the population that we work with, they are living often paycheck to paycheck. A change like that will mean that they fall back into the uninsured safety net. One of the things that we want to prevent, medical debt is the number one cause of bankruptcies in this country. And we need to ensure that our patients are going to be resilient at the end of a medical crisis. We work with over 500 physician volunteers who have agreed to see patients at no cost. And last year alone, that meant that they donated $23 million in uncompensated care to our Safety Net Collaborative. Without that, we would have folks who would be in jeopardy of impacts to their credit, things that would then impact their ability to stay housed, their ability to get a new job. Many of the folks we deal with, about 75%, are working one or more part-time or gig economy jobs without access to health insurance. So we know in our community, housing is a high expense. If we keep people healthy, we're going to prevent homelessness, we're going to keep people in their houses, and we're going to keep them in the workforce. And we need that. Roughly 50%, if you take the uninsured, those on Medicaid and those on the Affordable Care Act, 50% of Duval County are at risk of losing their health insurance.
So we've talked a little bit about the good work that you do and why it's important and why it matters to people that are your clients or your patients. But I want to talk about some of the arguments against this funding that have come up at the Finance Committee meetings, and that a number of city council members seem why they're opposed to additional funding or why they support cutting the proposed funding. One of those is, this is something that the hospitals are benefiting from. If we're alleviating the ER load, or reducing their number of uninsured patients, that benefits the hospitals. The hospitals make a lot of money. Why should the taxpayers of Jacksonville be shouldering this burden to take relief off of companies that are making millions or billions of dollars?
I can share a little bit. So our hospital system in the local community, when we talk about 23 million of donated health care, 65% of that was from Ascension St. Vincent's last year. The hospitals are in it with us. Baptist Health provides support all the way up to and including MD Anderson Cancer Center care for the uninsured. In addition, when we have our hospitals serving the uninsured, all taxpayers are impacted because those numbers go to Tallahassee, and the hospitals do receive some compensation back, and that comes out of our taxpayers' dollars. So they're in it with us. They're not standing by and hoping that we'll do all the work for the community. They are with us shoulder to shoulder, and that can mean direct funding to our clinics, but it also means that incredibly valued uncompensated care for our neighbors.
Can I add something
Certainly,
to
yeah.
this? I also want to share, you you gave the full number of what was originally in the city's budget, around 3 million, little over. I know for my clinic alone, last year I prevented $26 million in emergency room care. So I think what we're trying to do is not say how important emergency rooms are and how important our hospitals are, but we don't need people living with asthma, with diabetes, with hypertension, utilizing emergency rooms when we can take care of that inexpensively, efficiently at our free clinics and our charitable clinics.
So that is something that also came up at this meeting. Dr. Matthew Thompson, who's the CEO and co-founder of the city's telehealth partner, Telescope Jax, spoke about that and that kind of referred cost. Let's take a listen.
If you're uninsured, you don't feel like you have anywhere else to go, you're going to get a bill for that. The city funds UF Health $56 million a year to take care of people. As a taxpayer, why would I want that money to go towards a $5,000 bill that could have been avoided? I want that money to go to people who have end-stage renal disease, who are very sick, who need surgery.
So Mia, I'd ask you about that because, a lot of people have said on the council, we shouldn't be in the healthcare business. And there is some evidence that we are, to some extent, in the healthcare business. What is an appropriate level? I mean, some city council members say this just shouldn't be on the taxpayers of Duval County.
What I say to that is that it's really important for us to look at our history here in Jacksonville. Jacksonville is a consolidated city. So that means our city and our county are connected, and we have consolidated so that we could save money. In doing that, every other county around the state funds healthcare at various levels. We don't do that. Over the years, fewer and fewer dollars from our city have gone into our healthcare pots. And so it's our responsibility to make sure that the city does their part. They can't say, oh, it's the state. It's not the state. We are a consolidated government, meaning that we are county and we are city. And the county is responsible for putting funds into the pot to make sure that healthcare services are provided within our communities. And when we ignore that, then what we do is we create more problems for us as a community. And what we're saying is, we were smart enough in the 60s to say, we know that there's a better way to do this. We shouldn't have money going into the county and money going into the city. We should come together and put those dollars together. We don't need 2 police departments. We don't need 2 fire departments. In doing that, we need to say, we've done some things right. We need to continue to do them right, but we need to make sure that they're properly funded.
Jennifer, I want to ask you because in addition to your work with Volunteers in Medicine, you're also on the board of the Nonprofit Center of Northeast Florida. And we're talking largely here about nonprofit providers, healthcare providers, but the overall nonprofit landscape is also facing a lot of challenges, federal, state, local budgets.
Yeah, so as part of being on the board of the Nonprofit Center and being a lover of my nonprofit partners, I love the work that we all do together. We are a big part of our community. We are constituents. We are voters. There's over 1,400 nonprofits in our community with a combined revenue of over $12 billion. We're one of the top employers. And a lot of what we're doing is contributing to our communities. We're keeping people in homes. We're keeping people healthy. We're doing a lot with a little. We rely on volunteers. And it's unpopular to think that nonprofits are lazy, are not educated. It is popular to realize that we all are overseen through Candid, which is a way that measures nonprofits and their success and who's efficient. We are employing people with PhDs, with doctorate degrees. And so I just want to advocate for the work that we do, over 1,400 organizations, businesses, nonprofits are businesses, and we're doing the work, and we do it a lot of times very inexpensively, and it has a huge community impact.
The other point that some city council members have made, and I know that Nick Howland, who's the vice president of the council, has made this point that he says it's a false narrative to say that we're cutting because, in fact, what this budget proposes, the mayor's budget proposes, would increase spending. And so in some cases, they're asking, just hold it steady. Why should we be expanding these programs? And so his point is that it's not budget cuts.
As much as I do respect his opinion, looking at our history, again, these nonprofit healthcare programs were part of the strategic plan for the council. In 2022, there was a 6-month study of the community, the critical quality of life issues. One of the components was specifically around healthcare.
And why was that?
That was because of all of the challenges that we have in our community. We have got just a little bit of information. We have 15% of our community living at or below poverty. That part of our community is desperately in need of support through medical crisis, through chronic disease, through all the things that we know can prevent you from returning to the workforce or to being meaningfully employed. Everyone in our community deserves a chance at a next step. And what our council members may not realize is that study in 2022 found that the work that we were doing in the nonprofit sector was exceptional, and the data is there to back it up. So we were funded in 2023. It is to say now that it's an expansion or we're not going to fund it, it's just not correct.
You mean we're funded in the prior mayoral administration of Lenny
Correct.
Curry? This is not something that Mayor Donna Deegan came up with.
Exactly. And the fact that we have support both from Mayor Curry and Mayor Deegan just goes to show you that these are not political decisions. These are decisions about the local environment. And we believe that our local government, they say all politics is local. We believe that it is up to our city council to ensure if there are cuts at the state and federal level, that they're looking out for our neighbors. And part of that is looking at the history and making sure we're not cutting from the programs that were already put into the strategic plan.
Mia, one of the things that I've heard Angela say at these meetings is that a cancer diagnosis makes a person 2.5 times likelier to declare bankruptcy within 5 years. And so just in terms of family impact, I mean, we've been talking a lot about finances, and obviously declaring bankruptcy is destabilizing, but what is the ripple effect of something like that for someone's family, for their friends, for their community?
What we're finding is, and AGAPE has recently embarked on increasing our behavioral health services. As we listen to our patients, listen to the stories of what they're living every single day, when you start talking about a kid having to hear mom talking with someone and making a decision on whether she's going to buy medicine or whether she's going to buy food, or whether we're going to put gas in the car or we're going to take the bus in order to get around the city that we know is huge. It becomes a lot of stress. It then compounds. So not just that parent is dealing with it, but then our children are having to deal with it. We're seeing cuts in free and reduced lunch. We're going to see additional cuts coming as it relates to food stamps. So every piece of the pie is being cut for our most vulnerable. And then we're giving tax reductions to those who have. And I was raised at a time where those who have gave to those who didn't so that we could all have a better quality of life.
Jennifer, just as kind of a final thought, I mean, this vote is Tuesday. The city council will be deciding this budget at that meeting. What do you suggest people who care about this issue do between now and then?
What I suggest people do is if you are a neighbor to a city council member, reach out to them and talk to them about this. Attend the city council. We're talking about quality of life of our neighbors, of our community. If you are sick, you are not happy. You're not working. You're not going to play with your kids. And what we are doing with this small amount of money is preventing these major crises. We are preventing major emergency room visits. We're trying to provide screenings, provide these inexpensive interventions that, if untreated, are very expensive, are very overwhelming, and are destroying families. So let's just remember we're humans and we all want to be happy and we all want to be healthy.
Well, Mia Jones, Angela Strain, Jennifer Ryan, thanks so much for being here today. Really appreciate it.
Thank you for
Thank you.
having
Thank you
us.
for having us.